In life, there are some things that just work well together. Macaroni and cheese, knives and forks, rhythm and blues, Bert and Ernie. We think TCOM assessments and motivational interviewing could be added to that list. Both TCOM assessments and the practice of motivational interviewing can be applied by helping professionals as they engage and guide individuals and families through a transformational experience. Motivational interviewing is a style of counseling intended to facilitate behavior change. TCOM assessments, like the CANS, ANSA, and FAST, are multi-purpose tools intended to accurately represent the shared vision of the individual or family and the helping system and facilitate the management of the transformational experience. The use of TCOM tools and the practice of motivational interviewing is not intended to be manualized or prescriptive. They are intended to be implemented within helping systems that rely on adaptive, person-centered approaches over a rote series of scripted tasks. Each assessment experience using a TCOM assessment, similar to each application of motivational interviewing, should be tailored to the individual, to their story, their experiences, and their desires for change.
When using TCOM tools to fidelity, the approach is culturally responsive and respectful. It acknowledges the agency of the individual and their choice about participating in and completing any assessments and interventions. It prioritizes an assessment process that is personalized to the individual and collaborative with an emphasis on consensus-based action that will lead to change. Motivational interviewing is guided by an underlying spirit that is collaborative, seeks to engage people's perspectives and values their experience, is empathetic and respectful of a person's right to make informed choices, and seeks to promote the enhancement of a person's well-being.
Practitioners who successfully integrate motivational interviewing and TCOM assessments can utilize that overlap in both strategies as a guide for their practice. For example, when preparing for and conducting an initial TCOM assessment with an individual or family, the assessor might focus on the task of engaging or building rapport through the use of open-ended questions and affirming responses. They might seek to build trust by exchanging information about the use of TCOM tools within a collaborative assessment process, sharing information about what a person can expect during the assessment and how it will be used in designing individualized care plans. Practitioners may use the TCOM tool to highlight the focus of the assessment process. For example, they can recognize shared perspectives on identified needs and useful strengths. The shared perspectives are documented on the TCOM assessment using the needs and strengths action levels. Different from assessments that rely solely on the assessor's judgment, the action levels of TCOM tools are utilized to build consensus around areas of an individual or family's story where there's a shared interest in taking action and creating change.
During the assessment process, it is important to explore individuals' desire for change or reasons why they might benefit from supports or interventions that target their actionable needs. One of the core principles of motivational interviewing is the belief that individuals will be more likely to take action to facilitate change if they have voiced the need for action and articulated the related goals. Both motivational interviewing and TCOM are organized around the idea that change cannot be achieved without the partnership of the person in care. The work of aligning perspectives and creating shared visions inevitably leads to uncovering conflicting ideas about the need for change and the process for achieving change. Motivational interviewing recommends rolling with resistance, seeking to understand a person's ambivalence about change. When using TCOM tools, assessors are encouraged to keep the focus on the importance of consensus around action. When there is a lack of consensus, assessors are instructed to document that further assessment and additional information is needed before deciding to take action. This approach allows for consistency between the work and the documentation of the work.
There is strong support for the integration of these two approaches within the transformational offerings of children's and adults' mental health and behavioral health systems, and child welfare and juvenile justice systems. For more information about motivational interviewing, TCOM assessments, and strategies for linking the two, please follow the links in the descriptions.